Hello again, welcome back to Mental Health and Me. I'm Finley, and if you've watched the first two videos, you'll be fully aware what this is all about. As you can tell, there's zero thought going into these videos. I'm trying to take out the 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 perfectionism part and just go with it. I have no idea what's going to come out my mouth next, but just going to go with it. So I thought I'd carry on from where I left off. So as I say, I ended up having to leave my job, and at first I didn't know what was going on. I didn't. Going back to 2008ish, so not a lot was really said about mental health as such back then. I didn't really know who had it, people had it or got it. So I just didn't really know. I was encouraged to go to the doctors and things, but I didn't want to. I didn't want to talk to people about it. But I did. In the end, I went to the doctors, and they I had to fill in a questionnaire and blah de blah, and I was prescribed an antidepressant. I mean, I can't remember what the first one was. While I went on, had been an absolute bucket full over the years while I've tried and that. And I was given an antidepressant, but I was so against taking any form of medication to help myself. Again, I probably saw it as a failure, really, that I needed this medication. I couldn't get my head around the fact that, you know, there was something a bit different in my thoughts, and I don't know, I didn't accept that I had an issue, really. But eventually, somebody explained that, like, if you had a broken arm, you'd have a cast. So antidepressants were like a cast for the mind or something rubbish like that. But anyway, I started taking them, and I must admit I love them. I need my tablets, I feel. I'm not bothered about what I take, who knows what I take and everything. It's irrelevant. It's taking tablets to feel better than what I was is just par for the course. I'm grateful that they can help me in the way that they do. So, to anybody out there that sort of, worried about being on tablets for life or short term, and what does it matter if it helps? Why worry about it? If it helps you feel better today, then it can help you tomorrow. Why worry about 10 years time? Just see what happens. It's just, I'd encourage anybody, if you're prescribed medication and you feel it works, don't be in a rush to come off it. Just keep, just keep going with what makes you feel better. Don't worry about, a stigma from taking medication for it. Don't worry about it. It's a help. It's just a medication with mental health, as I've learned over the years, is just one small tool to helping yourself live a happier life. So I wouldn't change it at all. But yes, I've been taking tablets now for, like I say, 13 years, 14 years. I take tablets of a morning and of an evening now. But again, I'll cover that in more detail. But please don't worry about taking medication, no matter what it's for, whether it's mental health or anything. any form of medication you're prescribed is there to help you. But be open with your doctors. Tell them if it helps, tell them if it doesn't, any side effects. I remember I took one tablet and it made me really itchy, you know, it was just straight. I wasn't expecting that side effect. I thought tiredness, maybe a headache, sickness, but it made me itchy. It's one of them. It was a surprise for us all. You just gotta be open to suggestions, but also feel free to do your own research. I mean, I've been fortunate with my doctor. She's amazing. You know, I do a bit of research myself about medication. I put it to her and she tells me, you know, why not try it? And we try it and we see what happens and we go from there. But this is just, you know, a little video just to sort of encourage people to sort of worry less about taking anything, you know, or another thing, going to see therapists, counsellors, psychiatrists, CBT therapists, anything, you name it. Hypnotherapists, why not? If you think it will help, try it. Why not? Just go for it. I mean, over the years, I was, again, I'll talk more detail, but I was dismissive of CBT. But I feel now, and I've got a better understanding of what I feel will work and why it will work. I learned, like I said earlier, that taking medication is just a small tool, and you need a lot of tools on your tool belt to deal with mental health, no matter what level it is. Bipolar, PTSD, everything. It will be more than one thing you'll need to help you, and you'll learn that. And it's a lot of it's trial and error. It's a lot of self help. And again, I thought there'd be a miracle cure, one tablet sorted, but it doesn't work like that. You have to just keep doing what you do. The good days, the bad days, you're learning all the time. You're learning with your mental health, and just keep going. Just keep learning. You know, there's no such thing really as a bad lesson, because you've still learn from it. You know, if that doesn't work for me, try something else. You know, but don't be ashamed if you take medication or you see therapists. Don't worry about it. Nobody's judging you. A lot of people who probably don't realise it, could benefit from, you know, having the occasional talk to somebody who can, you know, just maybe give them a bit of balance to things in life. And why not? Why not? So I suppose the takeaway message from this is, don't be ashamed about being on medication or needing help. Just feel free to talk. Always talk. Always say help. And it's the only way, really. So thank you for, actually, before I go, because as you can tell, there's absolutely zero plan. I got a Instagram page, I think it's still going, and again I'll talk more about it, called My Words, Our Thoughts, and it was poems I wrote about mental health, 30-40 odd on there on Instagram. So I'll put a link in the description, as the trendy people say. And again, like I say, thank you for watching. Hopefully see you all soon. Take care.